Good morning, and thank you for being here today. My name is Sherry Brummins, and I'm the President and CEO of the Alliance of Community Service Providers. We are a coalition made up of human services organizations across the Philadelphia and surrounding region. Our member organizations provide critical services including mental health care, substance use treatment, services for people with intellectual disabilities, and support for children and families. We are here today to sound the alarm about an ongoing state budget impasse. As of today, we are 116 days without a signed budget in the state of Pennsylvania. Despite what you may have heard, this impasse is not just a political problem. It is in fact a human problem. A problem that's having devastating effects on physical and mental health programs, housing supports, substance use treatment, and child welfare services. You see, when the Pennsylvania state legislature fails to pass a budget on time, everyday citizens like you and I are impacted. Payments to community service providers are delayed, and that means that the very organizations that care for our most vulnerable residents are left without the funds that they need to operate. These are the programs that keep our people safe and healthy. They're the domestic violence clinics that provide emergency shelter, the mental health and wellness providers helping people in crisis, and the early childhood programs that allow parents to go to work and provide for their families. But right now, many of these organizations are being forced to make impossible choices. Every week that goes by without a budget puts Pennsylvanians more at risk. And here's the harsh reality. Human services providers were already struggling before the state impasse began. As most of us are aware, earlier this year, the federal government passed sweeping legislation that came with deep cuts to safety net programs. Those cuts are already reducing funding for mental health block grants, housing assistance, child welfare, and workforce development programs that our state and many other states rely on to sustain essential services. So let us be clear, our providers are now facing a double blow. Federal cuts that weaken the safety net, and now a state budget stalemate that's choking off the remaining lifelines for our providers and the people they serve. The result is that the community programs are maxing out their credit lines, cutting staff, closing doors, and while the need for help continues to rise. This isn't about politics, it's about people. Every day of a delay means someone's therapy appointment is canceled, someone's shelter bed disappears, someone's child care center closes. So our message today is very simple. Harrisburg needs to get back to work and pass a budget now. The people who rely on these services cannot wait, the providers who deliver them cannot wait, and Pennsylvania's communities can't afford another day of uncertainty. When government stops working, people start hurting. It's time to end the impasse and fund the services that keep our communities strong. You're going to hear today from several providers and other services in the city of Philadelphia who are also being impacted by the state budget impasse. And the next person I'd like to introduce is Janine Litsitsky from Mental Health Partnerships. Thank you.
Thank you, Sherry. Good morning, and thank you all for being here. As you heard, the Pennsylvania state budget is now more than 115 days late. It's more than a number. It's days of uncertainty for nonprofits across our Commonwealth and for the people whose safety, stability, and recovery depend on us. For organizations like Mental Health Partnerships, it means we are not being reimbursed for essential services that we deliver every day. Services that keep families safe, stable, and well. Let's talk about accountability. If any of us managed our organizations this way, delaying payroll, ignoring invoices, or leaving those that depend on us in limbo, we'd be held accountable. The same should be true for our state leaders. This gridlock has a ripple effect that reaches far beyond Harrisburg. It's felt most deeply by those who rely on us, citizens across Pennsylvania living with mental health issues, families in crisis, people rebuilding their lives after trauma, homelessness, and other crises. People like Corey Lee, who first came to our New Life Recovery Learning Center this year while experiencing homelessness. He came looking for basics like food and a place to shower, but he found so much more than that. Connection, encouragement, and a recovery community that met him where he was and walked along his journey with him. With the support of staff, Corey began rebuilding his confidence, honing his job skills, and rediscovering his creativity through art. Corey said in an interview, "This place has been a big catalyst, helping me be the better version of myself. When funding is unstable, lives become unstable. And for those that we serve, instability is not just an inconvenience. It can mean losing housing, losing treatment, losing hope, and in some cases, losing your life. Let me be clear about the financial impact. Like many other nonprofits, Mental Health Partnerships has had to take out lines of credit to keep programs running and staff paid, borrowing into the 7 figures just to stay open. High interest on these borrowed funds, often tens of thousands of dollars annually, diverts resources that should be helping people, not enriching banks. Those funds could expand outreach, could expand direct services. Instead, they're lost simply because the government misses its own deadlines. During the last budget impasse, one of our peer specialists, a woman who had overcome addiction and homelessness, told us, "If MHP has shut its doors even for a week, I don't know if I would have made it." Today, she's thriving, she's working full-time, she's mentoring others on their recovery journey. That's what's at stake. It's real people, it's real outcomes, and it's precious lives. If this pattern continues, nonprofits will face heartbreaking choices, whether it be cutting programs, turning people away who are in dire need, laying off staff, or closing doors altogether. But it doesn't have to be that way. And I don't want to make those hard choices, and no organization dedicated to helping people should ever have to, just due to political gridlock. The broader truth is this: nonprofits are Pennsylvania's backbone. We're the safety net that catches people when the system fails them. It's not a partisan issue, it's about fairness, it's about responsibility, and it's about keeping our communities safe and strong. Mental health cannot wait on negotiations in Harrisburg. People's recovery, housing, and well-being cannot wait another week. So today, we urge our elected officials, not next week and not next month, but right now, do your job, pass the budget, fund the services that keep Pennsylvanians stable and strong. Next, I'd like to introduce Stephen Bronskill, the Coalition Manager for Transit Forward Philadelphia.
Thank you so much. My name is Stephen Bronskill. I'm the Coalition Manager for Transit Forward Philly. We're a coalition of 37 organizations supporting public transit and mobility in Philadelphia. It's a privilege to stand in solidarity with these incredible nonprofits and service providers. Can we give it up for all the amazing work that they do here in Philly to keep us moving? Yeah. Another thing that keeps Philly moving is our transit system. Nearly 800,000 people across the region use it to get to work, school, or wherever across the region. And one of the consequences of our failure to pass a budget is this summer we experienced 32 canceled bus lines, a 20% cut to transit service, and hundreds of thousands of our neighbors had trouble getting to work, school, and where they needed to go. We were just canvassing folks on the Fox Chase line, and we were talking to riders that while service has been restored, it's only been done by taking badly needed funds from our capital budget that keeps SEPTA safe and in service and using it to fund operations. As a result, we've had hundreds of canceled trains, delayed trains, and 5 fires on our regional rail trains, some of which were in service in 1973 before SEPTA was even formed. And so we're calling on behalf of all of us here in Coalition for our state legislators to pass a budget to fund transit, to fund the vital services that we need. I was canvassing also with our friends at SEIU, with airport workers who often go to their shift at 5 in the morning, sometimes catching a bus before regional rail even starts at 3 or 4 in the morning on the way to work. Those people who put the bags of politicians on planes, who help us get to our destinations all over the country and the world, do not deserve to have their rides to work cut. And so please join me in calling on all of our elected officials to do their job so we can get to ours. Thank you so much.
Thank you, Stephen. Next up, Anuj Gupta, President and CEO of the Welcoming Center.
Good morning. I want to thank Michael and Sherry and the Alliance for bringing us together this morning. I have a question. Does anyone like games? Does anyone like games? I love playing Risk. I love playing Monopoly still. Harrisburg seems to be enjoying playing a game. Except the pieces are not plastic novelties. They're not cardboard cutouts. They're real lives of Pennsylvanians. This notion that politics has been debased to a blood sport, to a game of mutual destruction, defies the very precepts of what our system of government is designed to engender. An outcome in which no one gets everything that they want, but everyone can and should get something. In running an organization that serves immigrants across Greater Philadelphia who are coming here in search of opportunity, I've learned one thing, that no matter how different we think we are, by race, by language, by religion, income, or geography, at the end of the day, the vast majority of us all want the same things. Find me one pocket of Pennsylvanians that don't want better schools for their kids. We need a state budget for that. Show me a community where people don't want access to doctors and care providers when they need it. We need a state budget for that. Show me a pocket of Pennsylvanians that don't want access to job training and pathways to upward mobility to provide for themselves and their families. We need a state budget for that. And there is no corner of the state where you will find people saying, we don't want small businesses to thrive. We don't want more jobs in our community. We don't want strong commercial corridors providing amenities for neighbors and visitors alike. We need a state budget for that. This is not a game, and it's certainly not one that Pennsylvanians signed up for. It's actually a job. And as everyone here will attest, sometimes doing your job is hard work. So we need our leaders to act, to do their jobs, do the hard work, and get in a room together and get a budget done. No one wants to play this game. Thank you.
Thank you, Anuj. Next up, Anne-Marie McDowell from Chorus Services, President and CEO.
Good morning. As stated, my name is Anne-Marie McDowell, and I'm the CEO of Chorus Services. We're a nonprofit leader of children's behavioral and mental health and educational services, serving over 19,000 of Philadelphia's children every year and working in over 240 schools. I certainly appreciate the opportunity to speak on behalf of both Chorus Services as well as other child-serving agencies in Philadelphia and across the Commonwealth. However, I am afraid that all of our letters, all of our pleas and testimonies seem to be falling on ears that are not hearing the cries of the people, and in our case, our children and families that we work with. I plead today with all of our legislators who are truly making very difficult decisions that we understand, and who I and others have elected and believe in, please, in the midst of federal uncertainty, now is not the time for our leaders to be so remiss in their obligation to pass a budget that is serving the Commonwealth. At the federal level, SNAP benefits will no longer be fully funded. This impacts our vulnerable children's ability to have food. No matter how any of us position ourselves politically, the impact the federal government has had on our immigrant population is impacting our children as they wrestle with both their own fears as well as the fears of friends of a very uncertain future. They don't understand the adult decisions that are being made. This creates an emotion of fear and anxiety in our children. It's getting cold outside, and now our children risk cold homes as their parents minimize heat in their homes due to heat delays. Our vulnerable children will risk living in unideal conditions, resulting in illness, exhaustion, and an inability to concentrate on their education. The federal list certainly goes on. And yet, despite the pending food insecurity, increased fear and anxiety, less than ideal living conditions that our children will be facing in the immediate future, the state is choosing to further threaten not only our most vulnerable children, but actually all children across Pennsylvania. Currently, our children at risk of abuse and neglect aren't considered a priority for the state. We don't consider them essential. So all funding has ceased, straining both the counties and/or organizations working closely to keep children safe. Hard decisions at both levels, the community level and the organization level, are being made daily as to what to fund and how to reduce. These are the children that most need to know adults are working to keep them safe no matter the cost. We all know the impact of the budget on school districts across the state. Borrowing's high, and districts are reducing programming to minimize the drawing of their own lines to keep their doors open. This is the same for our early childhood programs. Administrators in both systems are wasting time making decisions about money instead of education. And programs, particularly for our most vulnerable youth, are being reduced. Our children risk months of low quality or lower quality education as schools continue to make reduction decisions. There's also one other concern that I have as the CEO of a large family resource center here in Philadelphia that does, like I said, support both mental health and behavioral health as well as educational well-being of our children. This concern has never been mentioned in the context of not prioritizing our children in the midst of this budget impasse, but I think we need to talk about it. We have not truly considered the longer-term impact on Pennsylvania's child-serving systems when we are so clearly demonstrating the lack of priority we have towards timely funding for the young people who are our future. The workforce of educators and mental health and behavioral health providers are already strained, and we need more workers across the state. And yet we are continuing to make their jobs harder with less resources and creating an instability in these fields. The impact on today's children is that we have tired workers serving our children who are wondering and who are asking when they might be laid off. And the impact on our future children in Pennsylvania is that we will have fewer workers entering these fields due to the instability that we continuously face. That is not a bright future for our Commonwealth. Our children are our future. Please see that the decisions or lack of decisions that are being made is resulting in growing anxiety, fears, and a lack of belief that our government and adults in general care enough about them to work together so that they can be served with all of the best. I plead with you, we plead with you, on behalf of the close to 3 million children in Pennsylvania who do not have a voice in the elections, to finish this job, negotiate well, and don't leave the table until we do what we need to do to care for those that need our support. Each day that lapses, educational and child welfare institutions are weakening more and more, as we are all doing the best that we can with no funding but from the bank to keep doors open and services alive. Next, I bring up Jen Edmonds, public service worker from SEIU 668.
Good morning, everybody. I hope everybody is doing well, considering what we are all dealing with. Okay. So, as stated, my name is Jen Edmonds, and I am a proud member of SEIU 668. I am a public assistance caseworker serving families here in Pennsylvania. Every day, my colleagues and I help individuals access vital public benefits such as the Supplemental Nutrition Assistance Program, also known as SNAP or food stamps. In my job, we hear from parents doing everything they can to make ends meet. We hear from our seniors who have worked their entire lives only to need food assistance to make ends meet. And we also help Pennsylvanians who simply need a fair chance to get back on their feet. Food assistance is not a luxury, it is a lifeline. This is why I stand before you today with a deep sense of urgency. This administration, their decision to block Pennsylvania from pre-issuing November SNAP benefits during a federal government shutdown is cold and heartless and especially unnecessary because they're making a decision to do this to us. Here in Philadelphia, as well as across the Commonwealth, families are already living in a state of crisis due to the shutdown and the ongoing state budget impasse. Now more than 2 million Pennsylvanians face the devastating threat of delayed access to food. Adding to this crisis, we are a little bit chilly today, right? Fingers going numb, everybody's cold. Well, we're gonna have to delay our LIHEAP benefits. These benefits help families heat their home. They're also being postponed due to a lack of funding. As the temperature drops, delaying heating assistance puts Pennsylvanians in physical danger, especially children, older adults, and people with disabilities. If these delays continue, families will suffer and feel more lost and desperate to provide for their loved ones. We're talking about our neighbors, our co-workers, our family members, and my union siblings. This will create a worrisome and unsafe conditions for the public and for the workers who serve them every day with compassion and professionalism. Meanwhile, these political leaders in Washington allowing working class Americans to bear the burden of their political gains while they're still being paid. The federal government has the power to prevent hunger, to keep homes warm, to provide stability, and in a moment of profound uncertainty. Choosing not to act is simply unacceptable, heartless, and cruel. This, combined with our state budget being more than 100 days overdue, is causing Pennsylvanians to feel squeezed by this political gridlock. While politicians point fingers and play games, it's our families, our neighbors, our essential workers who keep paying the price. Hundreds of public service workers, including case workers, aging specialists, and mental health staff, have received furlough notices, and enough is enough. Our demand is clear. This administration must use the same authority previously issued in 2019 to protect our most vulnerable populations. This must protect access to November SNAP benefits and ensure energy assistance reaches those who need it most. Public policy should never abandon the people it is designed to serve. They must reopen the federal government now. We need a state budget that includes stable funding for all public services. SEIU Local 668 members will continue to show up for our communities. We won't let this government keep us from serving the people that are in need. We call to those in power to show up as well, and plain and simple, we need you to do your job. Thank you. Enjoy the rest of your day.
Well, I think that the message is loud and clear. Harrisburg needs to get back to work and pass a budget. It's time to end the impasse and fund the services that keep our communities strong, that keep our workforce working, and keep services coming to the people who need them. That concludes our press conference for today. If you have any questions, please feel free to reach out. Michael and Julie are standing right in front of me here, and they can certainly be a conduit to any of the people behind me. So thank you.